The response that we received from the HSE confirms what many families in the county and indeed around the area have been saying to me, and something that many families in the immediate area have experienced, which is issues accessing dementia care and a lack of specific supports within the county to support those living with dementia and their families. And quite clearly, there's simply not enough dementia-specific capacity within the county. As you said there, based on the response from the HSE, that there are just 10 dementia-specific beds operating in the services in Clare, and 3 then from the ASI, which are a private body funded by the HSE, and our remaining 17 then are dementia-specific beds in private nursing homes. So what that actually means is, that we have a drop in the ocean really in relation to the number of beds that are required versus what we actually have. And another part in relation to the HSE Midwest's response is that even in the Midwest region, across the 3 counties, we've only 137 beds, and projected dementia or estimated dementia prevalence in the general population is about 1,700 people in Clare alone. So we've 1,700 in Clare alone and only 137 specific beds across the wider region. So look, it is a huge concern. This was something I suppose that I felt was likely the case when I put down the question, because as I say, I have been dealing with a number of dementia issues in the locality in recent times. And when I brought this motion to the council in April, I did quote one case where a very elderly lady with dementia was transferred 3 times and was still waiting at that point for a dementia-specific bed. She was going from hospital to hospital to hospital waiting for a bed to open up. So it was quite clear on the ground that there were resource issues within the HSE. Now, look, they did commit and they did comment to a review which is ongoing at present to try and determine the needs. I think it's quite clear from the figures that they've given us that the needs are quite vast in Clare and definitely around the Midwest region. So it's a disappointing response, but I don't think it's anything we didn't expect when you're dealing with these issues on the ground.
With all that said, you will have the chance to meet Health Minister Jennifer Carroll-MacNeill next week. I'm sure this is an issue you'll be putting to her.
Well, look, we will certainly bring it to the highest echelons of government, and I will continue to engage directly with the HSE on this as well. There are a number of health issues, as we know, in the county that need to be addressed by government and by the HSE, and I certainly won't be found wanting in relation to raising those issues. And that's why I raised this. It's something that's close to my own heart. We've dealt with dementia in my family, and it's a very prevalent issue. There are a few families around the county that haven't some linkage or some dealing with dementia, and it is a very difficult disease. But it's even more difficult when you know the person that you're dealing with potentially is not getting the highest quality of care that's available. And based on these figures, we need to do more, and the HSE need to do more to ensure that they're building capacity within our dementia care units right around the county, both public and private.